Okay, let's now discuss the adrenal gland. So the adrenal gland, your adrenal gland sits on top of your kidneys. There's a center part we call your adrenal medulla, and then the outer part is the adrenal cortex. And this cortical part has three zones to it. There's an outer zone here. That outer zone is called your zona fasciculata. Then is a very inner zone. The innermost zone of it that wraps around the medulla is called your zona reticularis. Sorry, the top zone here is actually zona glomerulosa, not fasciculata. I hit up myself here. This is the zona glomerulosa. This is zona reticularis. And then the middle zone here, the biggest zone, is your zona fasciculata. And each zone makes a different hormone. Okay, so let's go first with the zona glomerulosa. Okay, that zone, in response to angiotensin 2, the hormone triggers this zone to produce cortisol. No, sorry, not cortisol. Produce a mineralocorticoid called aldosterone. And this drug, this hormone made by the glomerulosa, will in turn cause the kidney to increase sodium reabsorption. Means you will excrete less sodium in your urine. And at the same time, it will increase sodium reabsorption or retention. And at the same time, it will increase potassium excretion. So you will, at the same time, push more K plus out in your urine while pulling Na back out of the urine. Okay, and these are critical things, especially in your blood pressure regulation, especially sodium, because water will follow it back into the body. Then your zona fasciculata. That zone makes your cortisol. So in response to ACTH from the anterior pituitary, this zone will make cortisol. Okay, and cortisol in turn is what we call your stress hormone. Whenever you're stressed, this hormone goes up. Okay, and it tends to, when it's active, it causes you to increase the amount of fatty acids and glucose in the blood, so you can have energy substrates to make ATP to deal with the emergency. Okay. And in the long term, cortisol has some effects there. I'm trying to listen right now. Actually, in the long term, cortisol can be what's called immunosuppressive. You will get sick from long-term stress because it will suppress your immune system. So that's zona fasciculata. Then is zona reticularis. This zone makes androgens, which are hormones that tend to masculinize the body. Both genders require androgens. This one helps to set your libido, your sex drive. Also influences the expression or the growth of pubic and axillary hair. And also, this zone also makes some estrogens as well. And the estrogens that it makes will be critical, especially in females who are after menopause. So significant menopause. Okay, estrogen made by your zona reticularis. And next we go to the pancreas. Again, my boy getting stuck on it. Pancreas. So the pancreas, which sits beneath the stomach. All right. Bad drawing the pancreas here. Has more of a tail. Tail, like so. Okay. Has these islands in there called islets. So the islets, pancreas, these islets have 5 different types of cells in them. They have alpha cells, beta cells, delta cells, F cells, and G cells. Okay. The alpha cells of the pancreas islet, they make glucagon. The beta cells make insulin. The delta cells make your somatostatin, the same hormone. It's called growth hormone, enhancing hormone. The F cells make something called pancreatic polypeptide, and the G cells make gastrin. Okay. So right off the bat, let's talk about what these hormones do. So gastrin increases stomach activity. So it helps you to move the muscles in the stomach to help to digest your food. PP, which stands for pancreatic polypeptide, tends to decrease the activity of the gallbladder. So you make less bile, decrease bile release, and as well decreases the release of enzymes from the pancreas. So normally its job is to be active when there's nothing going on in your GI tract. So you want to suppress the release of both enzymes and bile. Okay. Your glucagon, this hormone is involved in, again, I think I mentioned before somewhere in this PowerPoint, that their job is to increase levels of glucose and fatty acids. That way you have energy substrates available to you to make ATP as needed. Insulin's job is to promote your cells to absorb glucose in the blood. So here you drop levels of glucose in blood, as well as levels of your fatty acids. So you try to store your energy substrates when this is in play. Normally after a meal, this goes up to promote you to pull your nutrients out of the blood and store them in your cells. And most cells require insulin especially in order to absorb glucose. You know, some exceptions would be your kidneys, brain, RBC, I think one more here, and kidneys, brain, and also liver. These 4 organs or things can get glucose without requiring insulin first. Insulin is required normally for you to express the receptors that can pull in glucose, called your GLUT4 receptors. Okay, it's insulin's job. And then your delta cells, their job is to control both insulin and glucagon. That way these 2 things are not allowed to move the levels of substrates in the blood up and down rapidly. Okay, so it controls them. That way you keep a constant supply of nutrients in the blood. So you know it keeps nutrients from fluctuating too much in the blood due to the effect of insulin and glucagon, which will spike and depress the levels, very, very dramatically so. The last thing I want to talk about in terms of hormones here is the production of vitamin D. Okay? Vitamin D production is controlled by 3 different organs. So first, you have cholesterol, or a cholesterol-based product. Cholesterol is converted to cholecalciferol by UV radiation to the skin. So when UV hits your skin, it converts this into cholecalciferol. Then cholecalciferol is converted to calcidiol by the liver. And then calcidiol is converted into calcitriol by the kidneys. And then this is the active form of vitamin D, which of course promotes you to absorb calcium from your small intestine, among other things. Okay, we'll pause there.